Hi. No, that's fine. I didn't realize there was gonna be so much, and I didn't. Uh, Sorry, I want to turn more lights. I didn't anticipate it slowing down so much whenever I was like trying to enter into the fields and check the boxes. It was really lagging there. Sorry about that. I would have done this like I would have called you all about it last night or something. Otherwise, how much more time do I have in my current appointment slot? Just so I know. I'm fine. Okay. All right. No. If that's what is normally what we do, then yeah, sure. I was also kind of already looking for long term kind of follow up in some regard with counseling or something like that. But I wasn't sure if this was the appropriate place for that. But I'd say as a priority, it's just the eval, like you said, and then I don't know whatever. Okay, would that also be virtual as well? Okay, that's preferable. Yeah, thank you. I think it was written that way for me to get the correct dosage. I'm taking 2 tablets twice a day. Um, wait, disoclamine. Oh, wait, no. I thought you were. I have been having more seizures recently because of my lack of medication. So if I kind of like freeze up or anything, it's probably due to that. I'm at a much lower amount of Depakote in my brain right now than I should be. I've only been taking one Depakote uh, per day for the dosage. And I'm supposed to be taking two, and I was already barely at the level I needed to not have seizures. So, um, sorry, I didn't anticipate this at all, but I didn't know I was gonna lose insurance for this month. Otherwise, I would have been in a bit. I was doing a lot better last month. That drug you just mentioned is for gastroenterology. I don't know what dosage it lists there, but I'd say that's still current, probably. Yeah, it is. Yeah, Devel Pro X Sodium DR 500 milligram tab. Yep, yeah, it should be twice a day, but I've only been taking it once. Um, that's correct. Yeah, I have about this much left, and it's really difficult to build that up in my brain if I have nothing, and I will have very severe symptoms if I don't. So it's I've been trying to at least keep it like a mid level, and I think it's been working okay, but at the same time, it hasn't really. I haven't had a grand mal seizure yet, I don't think, but I also wouldn't really remember, so I'm not sure. Yes, yes, I do. I have 40 milligrams 3 times a day. Uh, I'm with the uh, Doctor McLaughlin. Um, here in well, he's right next to Lakeview Regional in down the road from me. He's an expert in that, so I still see him. Yeah, I have the current scripts from him for the next 6 months or so, and I think takes Medicare, so I should still be seeing him in the near future. I personally don't really stress about that too much, honestly. Like, I kind of err on the side of I feels a lot more comfortable keeping that kind of fast and loose. Like, I don't really, I never really referred to myself as, like, in that tense in the first place, and was always called by my name anyway, like my last name or something. So it 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 doesn't I don't feel very uncomfortable at all, like, about what people might call me. You know what I mean? It's just that's my background, and that's just kind of that feels comfortable to me. So I don't. You can call me my first name, or anything you want, and it's fine. Or just refer to me without a name. It doesn't matter to me. Whatever is easiest for, like, clinical practice is all I care about. I mean, I guess in the past I used to kind of react to that very with a lot of hostility. It kind of scared me a lot that people would always. And this may have just been how transgenders were treated in the past and things like that. And due to just things that move forward, I think it's in I feel like a safer place nowadays. But when I was smaller, uh, it it felt very, like, uh, not safe. Not like going to the doctors usually for me was never a scary experience. I'm a cancer patient. I go to the doctors, and it's just a normal part of my life. It's I feel no stress or anxiety about having cancer, about being terminal, about surgeries. I had my diagnosis and everything before I hit puberty. So I was in that group of childhood cancer that was known to not have those types of mental issues on themselves, because we just weren't developed enough. And that's how I guess I always explain my experience with this too, is uh, whenever those types of things would come up, and they did, that would stress me out a lot. A lot. I didn't understand why it was deviant from normal medical treatment to me. But I also received abnormal medical treatment to everybody else. And I do understand that now, but I didn't understand that then as much. Right where I am right now, I'm like a tenth of a mile from my parents' house, where I lived until a few years ago. And I lived my whole life there. I didn't move anywhere else. I mean, I kind of moved to, like, LSU for a while, but, like, at the same time, I didn't move because of basically medical issues and military service obligations. So I kind of just remained remote almost. And then when medical things kind of picked up and got too severe, and I had other injuries and things like that, and had to go through some surgeries to regain function of my hand and my arm. Um, that kind of that really hit me hard. And then kind of everything just moved forward with Social Security and disability, and then I just moved into that full time and just went straight into just focusing on medical care and going to my appointments, and things like that, which had been put off previously. And that's kind of where I grew up around here, with a lot of access to doctors and things like that. But um, I didn't really, like, move around for medical care. I didn't have a difference in that for school or anything like that. Everything was always very planned out ahead of time for me. I'm only physically in a different location than my parents due to my father having Alzheimer's dementia. They purchased a property for me, and I live here and I lease it from my family. I would say that I have been feeling a lot better since I've been on the estrogen for sure, and that was similar to when I was in high school. I went through full human growth hormone replacement therapy. I don't have the ability to grow or much function with regular hormones on my own. It's unknown if that's because of the chemotherapy related things or just the cancer. But I also had growth indications before I was even diagnosed with cancer, but it was also within a time period close enough to the cancer that they can't really say. They just know that there's a lot of medical things with me, but that I'd say when I've been on hormones, I have been much healthier than when I have not been. And about a year ago or so, I it was about the time period that I was informed of the human growth hormones and the buildup in muscles tissue that I had and things like that from that in high school would wear off. It was basically a timed it was a known numeral that they gave me, and it was correct. And I really started to look very bad by the end of it. And I say I have probably not looked better since I've been on the since I've started transitioning. Especially my biggest concerns were my chest and my upper body and my lack of strength and stuff like that. And just I looked very emaciated. You could see my heartbeat. It was not good. And now it just looks much better. I kind of don't. I may have not have realized that I didn't really like looking at myself as much, but I didn't. And now there's very obvious progress, and I just look so much healthier. And my weight has been good too. My final for most of my life, it's been very difficult to maintain weight. Besides the period of time where I was on the height of the human growth hormone, and in the past few months, basically, as building up muscle and weight and fat. I never had any fat at all. You could not see fat on me. You just see like the bones and like ligaments and stuff. I looked very, very sickly, and I don't look that way as much anymore. I look much healthier. Because of that, yes, for sure. I don't really like it at the same time that I feel better about like that, maybe emotionally. I also feel a lot worse right now because I have a lack of prescription medication. There's a lot of stress with changing my insurances and things like that. I've never had a period where I've not had insurance, and it's really, really showing. I've missed a bunch of appointments. My potential ability to even go see Dr. Bolme for my oncology appointment, which I had to reschedule in May. I don't know how I'm going to get there, things like that. Those types of things didn't happen to me before, so that is really kind of stressing me out a lot. But I have basically just been told to wait until May, and then I would be able to discuss options potentially with Social Security or anything like that. I would like to do things in the now as much as I could, but as I was trying to do earlier this month and things like that, but now that my medication is basically run out, I can't do that anymore because I do rely on like the Adderall and things like that because I have narcolepsy and I can't have promoted wakefulness at all. It's impossible. So, but when I have that, I'm pretty functional with that. But right now I'm just focusing on making food, trying to stay safe with how I move around so I don't fall and things like that. And then narcolepsy is directly related to my epilepsy and my seizure threshold too. So if I don't have if I'm taking the Adderall and I have the Depakote, I can guarantee I won't have a seizure. So I can plan to do something that might be a bit more dangerous, like that it might just be normal activities of daily living. If I don't have the Adderall, I can't guarantee I stay awake. But if I do have it, I can guarantee that, which means I have a bare minimum of seizure threshold that I have 0 of otherwise. And that's just, it's kind of like a double amount of symptom interaction from 2 different neurological conditions. We didn't know that I had epilepsy when I was born, probably, until I got the narcolepsy, which I got from brain damage from chemotherapy. So and I only really got my epilepsy diagnoses hammered down in just the last few years. It took me being on Social Security and going very frequently to the neurologist to do that. And that was something I put off in high school. But so a lot of my stress is just, I think, temporary, but it's I don't think it's not like I'm having some. I think one of the only good things that's been happening has been the transitioning, I'd say. I don't know. I would say that I was very hostile last year when I first saw a doctor who was asking me those questions, and that has stressed me the hell out. I'm not gonna lie. I was I was getting into oriented for like how I was trained, if that makes sense. I was not acting like a normal patient, probably. I and I don't like to see that. I wasn't like aggressive or anything like that, but it's different when it it felt kind of like the how things were asked of me and stuff like that, and I understand they were done in a way of probably psychology or something like that. It still was very difficult of a conversation, and I didn't really. I'm not asked what surgeries I would like to do. I've had a lot of surgeries, very life-threatening surgeries, far in excess of what the most intensive transgender surgeries to do, like entire, like vaginoplasties and things like that. That would be considered nothing to me for what I've had done for my cancer. It would be an actual afterthought. So part of my attitude is oriented in that, in like 14-hour surgeries, them stopping my heart, things like that. As a young child, only being able to successfully have a leg to walk on because of my size and things like that, learning how to walk again, stuff like that is just different. And I would say that I don't believe I'm interested in surgical things at this time for the whatever the bottom surgery would be, unless it would directly relate to oncology, or like non-functioning of like other parts of the genitals, like that could become tumorous in the future and things like that, for purely medical reasons. Yeah. So if removing either testes would improve the efficacy of hormone therapy or something like that, and would do so in a way that would like reduce cancer rates or something like that, which is a very concern for me, and a concern for me for future cancer treatments. Yeah, and that's what I kind of plan to do, but that's kind of more of my focus, unless it's something to that extent, and I've kind of barely touched on that with my oncology team so far. Then I would just say I'm kind of foregoing that. But I'm very interested in continuing to transition for the top. I want the top surgery to make sure that I have the muscles and the other tissue that are built up, because they did have to remove muscles from parts of my chest in order to repair my bicuspid. And they did tell me about that when they were going in for that, for like my 3rd or 4th surgery for that. And there was just issues with me. I didn't have normal surgical outcomes because of the chemotherapy itself, things like that. So having the top surgery is, from when I spoke to the surgeon at Ochsner in January, because I already met with their plastic surgery team, is I met with their specific like post mastectomy oncology, like oncologic surgery for breast cancer. Their team at the Clearview one, that location, and our discussion was primarily based around that, about oncology related previous things, what they observed from like muscle buildup atrophy and things like that. So I think I'm very set on having that because I believe there are genuine medical reasons to get them to fix issues like that for sure, so that I can kind of move forward. I like the breast development I've had so far. It's not enough for me, but I want any further development to also be accentuated by surgery, so that I can make sure I'm in the best place physically that I can be for my future, so I can just move on, if that makes sense. Yes, that's exactly correct. That's kind of how I think about things. I don't really understand the mental part as much, and I've kind of always, like I said, reacted hostilely to it. It's just kind of always kind of scared me. Yeah, it was exactly, this is what you have to do, and it wasn't just like that. Like in 2018, when I just had my shoulder dislocated for 3-4 months probably, and ground away all my bone and all of that, and didn't know because I have too much brain and central nervous system damage. I didn't feel the pain. They only found out because of a full chest X-ray for oncology, and then they freaked out. They rushed in and they were about to prep me for surgery right then and there. Um, that's been my experience. They only delayed it till the following Monday so that they could make sure they had the full team ready. That was it. It Everything for me has always been, you're getting wheeled in to do this thing. It's never been a choice. Yeah, exactly. That's definitely how I feel. I'm not opposed to the bottom if there is a medical necessity. I'm not opposed to anything like that. I do. And Austria seemed very confident that they could get it covered, at least under Medicaid. When I was on Medicaid with them, they did know that I was going to be on Medicare too. I'm not sure if, and I was told last year by staff at Crescent Care, for the Elysian Fields location. That's where they do that stuff, and I was seeing a doctor there, and one of their staff, they are focused but all surgical things were, and they had a surgical like coordinator and stuff, and she discussed at length options, but all of them were under Medicare. And at that point, I did not even know I could be on Medicare this year. I had no idea that was an option for me. I thought for certain last year, I believed that it was impossible for me to be on Medicare due to what I'd been told by not just staff but federal judges and things like that at the Social Security Administration. I believed I was on just Medicaid, but it also got to see anyone for Medicare as well, and it was always billed under that, and I was on some sort of special thing. I also see VA doctors too if I need to. So it's like, I thought that was set in stone for the rest of my life, but it kind of came out of nowhere that I would just immediately qualify for Medicare in May of this year due to being on disability for a certain number of months. No one had ever mentioned that to me before. But apparently it was a thing, and it said after 25 months, and I believe I've been on disability for longer than 25 months, so this could have been something new in Congress, but that's what it said on the letter, and it seems to be oriented towards the month I was born, by Social Security's records, and which is May. My birthday's on the 22nd, but they said that everything would start on the 1st, and Crescent Care believed that there was a lot of options for top surgery through Medicare, so I think that Ochsner will be able to provide that for sure, especially since I want to stick with Ochsner with their staff and stuff like that. I like their experience with that. They assigned me a different surgeon had wanted to take me on as a patient, but I haven't met with them. I initially saw for like who I guess is the head of the department and things like that. Was it December? Well, it was December, I guess. Was on the 23rd. I saw Dr. Adam Hawk for his specific clinic for breast cancer related things, and since it was the oncology hook-in, that's why I was sent to him. And I think that his team was gonna pull from other surgeons specifically for my case because I have such an insanely detailed surgical history across multiple states. With MD Anderson and stuff like that, they have decades to pull from, basically. So they got me. They told me verbally on the phone, and I think it was February, that they did have someone else step forward, and I don't know their name, but I don't think it was someone normally associated with the plastics for just that. It may have been another surgical specialist in their system for something similar, which they explained could happen in my case, for other surgeons to step up who have other specialties in other parts of the body, just because of the uniqueness, I guess. They seemed very confident that it would be a walk in the park for me because of how thin I am and stuff like that. They were like they're basically describing how the ease of access to that area and things like that. So their confidence leads me to believe that I don't have anything to worry about for anyone who would operate on me, probably. With interruptions in treatment, which there have been significant ones, I still have, like, today is my last day on the spironolactone, which I had been put on the 200 milligrams, so I was supposed to be been put on that in December, which I may have been for part of the month, but then lost like half of Medicaid, so I lost most of the probably I don't know, the concurrency of the therapeutic regimen that I should have had. I'm not sure how this medication works, if it's like, but it's like this one's empty, and this one was prescribed on 2/5, and I'm supposed to take 2 tablets by mouth every day. I don't even know if that's updated in y'all's system, but Dr. Johnson did prescribe it for me, and it just took a really long time to get that 100% worked out. And I may have been taking this at that dosage for like half a month. It said it is refill 1 times at 180 quantity with 120 left until 2/5/2027. So I believe that I was going to be put on a higher dosage of this by Dr. Penunti at Ochsner at my next appointment with her, and I was supposed to have this refilled once this month, and it is the 18th, and I haven't gotten it refilled, and I missed like a week or two off and on it. The second that I heard I wasn't going to have insurance anymore, because I was trying to keep this at the highest level I could and titrated, but I still have I don't know how much of the estriol I have left, but I was supposed to have been on 6 milligrams a day of this as of last month, or as of January actually, because I saw Dr. Penunti in January. He's been the one working to manage, I guess, and I think I'm probably going to transition to him as my primary care provider, or whatever that would matter under Medicare. I'm not sure if that's even a thing under them, but because that's all new. But I think they've been the ones who've been acting as the go-to for that, and they've been coordinating with Dr. Penunti on stuff and blood work and things like that. I will probably miss my blood work next month. I don't know if I'm even going to be able to see Dr. Penunti next month, even though I do normally see her virtual. I don't know if that's going to be possible, and I don't think I can't afford any prescriptions at all. The costs are like insane. I have access somehow, and I'm not in even Medicare themselves. When I was on the phone with them last month, were surprised. I have access to some sort of a plan, which for about $111 a month, I receive full prescription coverage, like no questions asked, is what it looks like. I'm not 100%, but it's what it, according to their website and their database, when I would enter in the medications and things like that, and I've never seen this, I was able to even get air-mailed Adderall at the dosage I'm on. I've never heard of that before. Wait, is that like because of a shortage? Because they were having a shortage issue around here last month. Oh, okay. And I'm not sure which pharmacy it is. I think it's a federal one, because the list did not have a name. It just said like pharmacy. And I never was on TRICARE, so I never got any like shipments from the military either. Even though I've received shipments from I've received them, but they were sent to like Walgreens, and they had like the military markings on them and stuff like that. But so I don't really know like what I'm supposed to expect, but it said that, so I haven't actually put in the estriol for it, but I'm pretty sure the estriol is going to be covered because the Adderall was covered. So if it was a cost thing, the Adderall prescription for me has to be a special manufacturer part of it because of the epilepsy. If I don't have that, I end up having more convulsions. It's part because of the L and or entimer or whatever. I remember I had a paper I would look up and read off of to refresh my memory on it, so that I wouldn't say something completely incorrect. But there was some sort of known complexity with it that isn't very complicated in chemistry, and that's why I can't just use those discount codes to go to like the supermarket. That's why I did that, and then I just had a grand mal seizure like that. And so the Adderall for me appears to be in the system for the feds, and it was like going to be $1,700. So but for some reason this plan or whatever that I could get access to is supposed to cover it. I'm not sure what's supposed to happen with that, but that's for medication wise. That's as far as I could tell you at this point. I'm in that lapse period right now, I believe. I will get on May the 1st, I can start calling Medicare again. And actually, they'll be able to like give me answers and things like that. It was pretty clear that they were not gonna be talking to me about the stuff that they could talk about because I wasn't like insured under them. But I already have my Medicare card. I have the number on my Social Security statement, and I can provide that to y'all's office if you want to see it too, which is a new thing. They just this year changed the Social Security statements to where it shows your Medicare information on the back. That's different. That wasn't a thing. But I already was receiving a special type of statement of benefits. My statement of benefits at one point was switched from a normal disabled person's who can like work and stuff like that. Like they have like one that looks a certain way. They switched me from that to what I'm currently have and has other information on it, and now it has the Medicare information on it, and it does not state a start date. So I believe that for all intents and purposes, the feds view me as being on Medicare fully currently, and all the information they sent me said that basically, but there's also somehow some sort of like start date, which I think was arbitrarily chosen based off of my birth month. And that's probably just in a law or something, and that's why they can't like start treating me or start processing things like that for plans. I can look at the plans, I can almost purchase the plans, but it doesn't go through. If that makes sense. So, and they did express that that is not normal on the phone. I mean, I think if y'all are covered with Medicare, if y'all accept Medicare, I'd like to have more appointments moving forward, just so I can make sure that everything is solid, and that I stay with like a continuity of care, just because I kind of feel like I'm gonna need that. And I don't mind once it's all covered, like just until I can like have all of this completely situated, just in case I also need a psychiatry to help with other facets of this potentially. I'm not sure how that would or wouldn't help, but I know Dr. Weiss did a lot of stuff for me in the background back in like 2018 and things like that. When I was just starting on Medicaid, they had like a dedicated team for that kind of, so it seemed like sometimes that's necessary. So I would say if I could just have like an appointment in May or something and just start things then. I mean, you can write it if you want, just so I can have something on hand, but if you feel like it would benefit the letter to do it like in the future, you can do that as well. I mean, it's entirely up to you. I don't think I'm ready right now to bring anything to any surgical team. So like if it's and also I'm really supposed to not have had any interruptions in my hormone therapy at all for like a certain amount of months before they can even consider it. So they they very much described it as that. They seemed like they could have done it in December if they wanted to for me, just because of my physiology. But it was if I could have had higher doses of medication and move forward with that. I'd like to see kind of what Dr. Pananti is planning on doing with me having full coverage of medication if that's what's going to happen. So we might just end up meeting for another year and then maybe presenting a letter or something. Like, let's say if we started in May of this year, if we went through May of next year, maybe making that a plan for surgery so I can see what the maximum amount they can do with endocrinology could be. Okay, great. Okay. Yeah, I don't know. I would say if you're able to are you able to remotely prescribe Adderall? Could you put in a script for that just so I could see if whenever I can't actually get it filled, but um it's me traveling is a very is a difficulty for me. So far because of Medicaid, they wanted paper scripts for everything. And I don't know if Dr. McLaughlin can write the dosage I'm on as a remote. I'm not sure if he can or can't. I don't have an appointment with him until June or July this year, so I'll discuss that with him then. But I figured in the interim, I might still not be able to afford to actually go to the pharmacy to bring them my paper scripts, and I'm not sure if that's even going to be covered or allowed under Medicare for May when I'll get my next prescription. So I was going to ask if you could put that in at the current 40 milligrams 3 times a day that I'm already at, and we'll just to see if they'll fill it remotely or if Medicare wants to do the mail order pharmacy thing with in-house, whatever they might decide. Because I'm not sure how I'm supposed to get a physical prescription to the mail order pharmacy either. I didn't. Oh, you guys do? Okay. Oh, yeah, my pharmacy that's on file, if you could just send it to them, it just. That's what they've said. I mean, they diagnosed me with ADD in the past and ADHD, so it's not. And I was diagnosed with that before I got cancer. So, I mean, it's not really a big deal. Uh, okay, so for how it was, especially for shortages reasons, the only way we've been able to get this to work for many years, and it's worked well, has been the amphetamine 30 milligram tablet at a quantity of 60 for twice a day for that, and then the oh yeah, okay, whatever. But and the dextroamphetamine, amphetamine 15 milligram tablet at 60, because that gives me another 30 milligrams for my third dose of the day, and then the amphetamine 10 milligrams, quantity 90 for to get the 40 milligrams for the whole day. I'm just lucky that I'm able to get the I was able to get to the the level of tolerance that I needed to exceed to get efficacious results at a lower dosage than most people for narcolepsy, because most people for narcolepsy it starts about 60 milligrams. For me, because of my weight, it was 40, and I just lucked out, I guess. What was weird about the Medicare thing, it did not ask for diagnoses codes. It just looked like if it was prescribed, it was filled. I've never. That's why it was weird to me. But it. Yes, yeah, correct. Yes, that's correct. Yeah, yeah. Send that. Send that to. Just have another person. sending that in just in case there's any issues with that, because I've seen you at this time period. That's fine. I don't care. That also treats my cluster migraine headaches as well. I don't know if that is something you can write down, but that's what Dr. Lenacek said. But whatever you need to do to make it work, yeah, put it down. Okay. 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 No, 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 not at all. Okay, see you in 7 weeks. Thank you. Where's the other? Oh, and does work, huh?